Hello, everyone, and welcome to today's special COVID-19 webinar hosted by the International Society for the Prevention of Child Abuse and Neglect. We thank you for joining us today and appreciate all you're doing to help children during this very challenging time. After 3 months of global lockdown due to COVID-19, restrictions are starting to be lifted, and media reports indicate an increase in domestic violence, with much speculation about what's happening in children's lives. The closure of institutions like daycares, schools, and churches obscures knowledge about how children and families are actually doing and what is going on behind closed doors. Today, we will learn about 3 diverse approaches that have been taken in Canada to collect data on family functioning during COVID-19, including advantages, disadvantages, barriers, and next steps. Right now, I have the audience on mute to avoid background noise. We welcome you to enter your questions and comments in the questions box throughout the presentation. The presenters will respond to questions at the end as time permits. We will also be asking a few poll questions toward the end of the presentation. Please note that the slides are available now in the handout section of this webinar. The recording and slides will also be posted on the ISPCAN website for limited time after the webinar. Then they will be archived and available for members only. Andrea Gonzalez is a member of the Offord Center for Child Studies and an associate professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University. Dr. Gonzalez is a Tier 1 Canada Research Chair in Family Health and Preventive Interventions. Her research program focuses on the impact of traumatic experience on brain development, behavioral outcomes and health, the intergenerational transmission of risk, and evaluating evidence-based parenting interventions. Lil Tonmer is the manager for family violence, suicide, and positive mental health surveillance at the Public Health Agency of Canada. She is also adjunct research professor at Carleton University. She's responsible for the development and implementation of surveillance systems, and her research focuses on the epidemiology and prevention of child maltreatment. She co-chairs ISPCAN's working group on data collection and serves on the editorial boards of Child Maltreatment and Child Abuse and Neglect. Finally, Tracy Afifi is a professor in the Department of Community Health Sciences at the University of Manitoba, an associate editor of Child Abuse and Neglect, and a Royal Society of Canada inducted college member. Dr. Afifi's primary research interests include child maltreatment, physical punishment, mental health, resilience, and prevention. She has been published more than 130 times in peer-reviewed journals and presented research and findings in more than 140 national and international conferences. Andrea, Lil, and Tracy, we thank you so much for being with us today. Now I'll turn it over to our first speaker, who is Andrea. One moment, please.
Sorry, I'm just getting slides organized here. Okay, Heather,
Yes.
are my slides showing?
Yes, they
okay,
look great.
Wonderful. So thank you everyone for joining us today, and really thank you to ISPCAN for hosting these amazing series of webinars, and in particular to John Fluke, Lil Tonmer, and the Data Collection Working Group for the invitation to present today, and to Heather for all of her amazing organization, at least getting us organized for today's presentation. So we all know that the COVID-19 pandemic has imposed sudden and unprecedented levels of stress and adversity on the global population. In Canada, our first case was identified January 25th, and by March 3rd, we had 33 cases across the country. Yesterday, we passed the unenviable milestone of our 100,000th case. And like many other countries, since March 17th, millions of Canadians have been experiencing some form of prolonged isolation, along with widespread economic hardship due to a range of strict public health measures that have been enacted at the federal, provincial, and county level. It's clear from other webinars to date, for example, from those presenting from South Africa and Italy, that the COVID-19 lockdowns came so quickly that it took everyone off guard. The rapidly evolving nature of COVID-19 has left government, public health agencies, academic and community organizations, really unprepared to rapidly adapt and fully respond to the increasing needs of caregivers and children who are coping with unparalleled challenges. We need data collected in various ways and at various time points from multiple sources to really understand how the pandemic is affecting families and children. So in Canada, sorry, I can't actually see my slides with this box here. So in Canada, between March 17th and March 22nd, every province and territory declared a state of emergency. In previous excellent webinars, we heard about the South African context and what's been going on in Italy. Here we have seen similar situations, but not all the same measures and restrictions have been imposed. So in Canada, we have 10 provinces and 3 territories, and most decisions about restrictions are made at this level. During the state of emergency, organizations and societal institutions, which are critical staples of family routines and functioning, all closed down. So schools, daycares, libraries, and churches have all been closed. This is a constantly evolving context and is different across the country, with each province and territory handling restrictions and reopenings differently. So at first, there were bans of not interacting with anyone outside of your household, but most recently, the bans have included no more than 5 to 15 people gathering together, depending on the province. Stores and many services were closed or canceled. And in most cases, alcohol and cannabis stores remained open, with the exception of cannabis stores in Ontario and liquor stores in Newfoundland, PEI, and Nunavut, where prohibition laws were enacted. The easing of restrictions has also varied across the country. So for example, in Quebec, elementary schools have reopened as of mid-May, with the exception of the capital in Montreal. In British Columbia, children had an option to return to school in June, with elementary school students returning 50% of the time, and middle school and secondary students returning 1 day per week. Only about 1/3 of children have been attending primary school, and even fewer have been currently enrolled in secondary school. In most of the other provinces across the country, there has been no return to school planned now until September. And in many of these cases, the restrictions have not yet been lifted, with only a phased approach, with stores opening and gatherings reoccurring. So it's widely assumed that these physical distancing restrictions, coupled with families forced to stay at home under extremely stressful conditions, likely leads to increased risk of family violence. However, we don't really know what's going on. Oh, I can't advance my next slide. Oh, there we go. Okay. So what do we know from other contexts? Limited precedent really exists for the current crisis of COVID-19. However, we can look at 2 fields of literature for some information. One is natural disasters, and the second is war or conflict. A recent systematic review, it's widely assumed that a negative outcome of natural disasters is violence against children. However, a recent meta-analysis of 11 studies did not find evidence of an association between natural disasters and violence against children. However, the authors did note that there is substantial heterogeneity that is attributed to differences in the operational definition of violence across the studies, lack of representative sampling, and unclear establishment of temporal order between the disaster exposure and family violence outcomes. A second systematic review that was recently conducted examined violence towards children and natural disasters or conflict, concluded that violence increases after many emergencies compared to preconditions, and that polyvictimization or exposure to multiple types of abuse seems more common in disasters, and that family members and caregivers of children are typically the main perpetrators of the violence. So for those of you who attended Barb Fallon and Delphine Colin-Veniza's webinar, you may recognize this diagram. Taking a social ecological framework, we know that natural disasters and conflicts elevate known risk factors for violence across multiple levels. So for example, at community level factors, there's the breakdown of social support networks and disruption of social services. House level risk factors include economic scarcity, such as unemployment, increased poverty and food insecurity, loss or separation from other family members, and changes in routine. Caregiver risk factors include increased stress, mental health problems, and substance use, increased harsh discipline and punitive parenting practices, decreases in family functioning, and at the child level, the child's own temperament and mental health problems and stress responses pose a risk. In Barb and Delphine's webinar, they highlighted that these known risk factors are associated with child maltreatment increases and that there is similar increase in risk for exposure to violence. One can see many overlaps from natural disaster and conflict context with the current situation. The COVID-19 pandemic is unprecedented, relevant to everyone, and touches all aspects of life. However, while similarities exist between COVID-19 and conflict or natural disasters, the current coronavirus crisis may result in closure of key organizations for longer durations than often occur in the aftermath of natural disasters. In addition, while community togetherness is often encouraged during a natural disaster, physical separation from community members is the course of action that is currently being promoted. As a result, the increase in family violence reports may be even greater than the increase in the observed reports following natural disasters and conflict. So what do we actually know about what is happening? If we look at the news, there are reports of increasing domestic violence that are beginning to surface around the world. In China, domestic violence is reported to have tripled during their shelter-in-place mandate. France has indicated a 30% increase in domestic violence reports. And these news headlines here are ones from Canada and the US that were in April and May, all indicating increased risk of domestic violence during COVID-19. We have a better sense of violence against adults because this is highlighted frequently in the news and adults can report incidents themselves or go to shelters. We know a lot less about what is actually happening with children, and much of what you see in the news headlines is speculation. Since the global coronavirus pandemic put Canada into lockdown mode, including the shuttering of schools, calls to the Kids Help phone line have more than doubled. At the same time, police forces and child welfare agencies across the country, including the Children's Aid Society of Toronto, say that the overall volume of suspected child abuse reports has dropped between 30 and 40%. In Desmond Runyon's presentation a couple weeks ago, the audience was polled about whether members thought that the rates of child physical abuse, sexual abuse, and neglect increased, decreased, or stayed the same. Overwhelmingly, we saw that people voted that they agreed that there would be an increase in child physical abuse, but there was some variation in responses with respect to the other two maltreatment subtypes. There is growing concern that we may see an overwhelming number of reports in child abuse or neglect when children do not return to school, or when children do return to school and daycares. However, if children do not return until the fall, and in Canada, that would mean that classes would resume in September, the concerns may be even greater given the length of time that children have been out of the school system. However, there is a huge gap between what we know, or what we think we know, and what we actually know. Much of what we know at the moment is anecdotal and is based on what is in the news, but needs to be supported by evidence and data. We need to understand now how the pandemic is affecting children and families and the risk of child maltreatment. COVID-19 data, kind of in the current moment, is needed for several reasons, including needing to learn new lessons to identify systematic weaknesses and resources in order to address these weaknesses. So the objective of today's webinar is that we're hoping to provide an overview of 3 surveys that are either launched or planning to be launched in Canada to examine the impact of COVID-19 on children and caregivers. Dr. Runyon highlighted important points of capturing children's experiences during COVID-19 in his presentation and mentioned that population-based surveys are the gold standard. However, it's very difficult to use population-based surveys in the current crisis. So we're going to outline 3 different approaches. One is crowdsourcing and web-based surveys. The second is general population-based surveys. And the third is a longitudinal project. So the first approach that I'm going to be talking about today is the Ontario Parent Survey. Before COVID-19 started, we were preparing a community-based survey to examine parenting knowledge and attitudes, as well as awareness of community supports and services in preparation for the implementation and evaluation of a parenting program in various communities across Ontario. When the COVID-19 pandemic started, initially we weren't certain how long it was going to last, but we soon realized what a monumental impact that this was likely going to have on families. So we pivoted rather quickly and developed a new survey to try and capture what families were experiencing, how they were coping, and what services they thought they needed. The survey was launched online on May 2nd and closed 6 weeks later on June 15th. So our methods basically included, we translated all materials into both French and English, as they're both the primary languages here in Canada. So all of our ads, the survey itself, and our websites were in English and in French. We had a social media campaign and partnered with an amazing marketing guru who developed media advisories to highlight the project. We contacted school boards across the province to see if they would be willing to share the study link with families. It was the only way we could reach families at this time point because everybody was in lockdown. We found out that some posted it on their Facebook pages or other websites, and other schools put the link directly into their weekly newsletters. We reached out to public health units and our partner mental health organizations to share the link with their platforms. And we had the link distributed through multiple organizations, such as the Ontario Nurses Association and the Ontario Municipality Association. We also advertised a random draw for Amazon gift cards as prizes. So our approach to measures and methods for the survey, we were trying to map questions from the survey onto various levels of the socio-ecological model to examine known risk factors that are associated with family violence. For community level factors, we asked for the first 3-digit letter combination of participants' postal codes, because this would provide us with enough information to map postal codes onto provincial administrative data sets that contain information about material deprivation. Material deprivation in these data sets is a measure of the inability of individuals and communities to access and attain basic material needs. Indicators included in this dimension measure income, quality of housing in communities, educational attainment, and family structure characteristics, such as the proportion of lone parent families. For household level factors, we included questions on household composition, so the number of individuals living together in a household and their age ranges, the number of rooms, whether or not the house was owned or rented. We included information about employment and the impact of COVID-19 on employment status. So for example, were individuals laid off due to COVID-19? Were they working more or fewer hours? We also collected information on caregiver mental health, so specifically questions pertaining to anxiety and depression, alcohol and cannabis use. And just to note, cannabis is actually legalized here in Canada. We also took information about other prescription drugs and parenting practices and partner conflict, which I will describe in more detail later on. Finally, at the child level, we asked about social emotional functioning of the child within the last 6 months and whether there had been any changes in functioning since COVID-19 started. So because of, in the interest of time and because of the interests of the audience, I'm really going to focus on presenting on 2 of the measures that are most relevant, a parenting scale and an interpersonal conflict scale. A consistent theme across all the studies that we'll be talking about today are barriers to asking sensitive questions about family violence in Canada. It's almost impossible to ask any questions that directly measure child maltreatment or intimate partner violence. Because of these restrictions, we tried to take a systematic approach in selecting our measures. So first, we looked at systematic reviews on the psychometric properties of parenting skills and attitudes. The Child Abuse Potential Inventory, or the CAPI, had the most acceptable ratings and reported psychometric information in 9 of the 10 evaluated categories. Other measures that had good psychometric properties included the Alabama Parenting Questionnaire, the Parent-Child Relationship Inventory, the Parenting Alliance Measures, and the Parenting Scale. We then researched which of these measures were related to risk of child maltreatment, and then we examined specific questions, subscales, and length. We ended up choosing 1 subscale, so the overreactivity subscale of the parenting scale, which is a measure of harsh and angry discipline, which is consistent with authoritarian parenting style. So on the right hand of the slide here is an example of some of the questions that the scale asks. And it says for each item, check the box or the circle that best describes how you may have dealt with problems over the last 2 months. And it consists of questions like, when I'm upset or under stress, I'm picky and on my child's back, ranging from that to I'm not picky more than usual. It also includes items about raising voice or yelling, spanking, grabbing, or hitting my child, using bad language, or criticizing my child. Now, in terms of our measure of interpersonal conflict, we looked at the prevalence of respondents. We had a similar issue where we couldn't ask questions from something typical like the conflict tactics scale, because many of the measures actually are looking at items that ethics boards would consider too harsh. So instead, we settled on a measure here about marital conflict. And the question is looking at disagreements within the last month that happened. And it's from both the respondent's perspective. So it asks questions about I was angry or annoyed or yelled or criticized my partner and spouse. And it also asks a series of items or questions about my partner and spouse was angry with me, yelled at or annoyed or criticized me. And the response items range from 0, from not at all, to 3, which was a lot. So just to give you some preliminary data that we found, this is really truly hot off the press because our survey just closed on Monday, and it's thanks to our postdoc, Divya Joshi, for even getting us any data analyzed at all so that we could present today. But what we had overall was 7,677 individuals consented and started the survey, with a total of 5,526 individuals completing the survey. So that was a 72% completion rate. The majority of the participants, about 85%, were married or common law, which is slightly higher than the Canadian prevalence of 71%. most had, about 50% had a bachelor's degree or above, like a university degree or above, with about 33% having a trade certificate, a diploma, or a college degree. Looking at items from the overreactivity scale, the question on the far left was the most extreme range of responses in the middle column. So we calculated the percent of negative or ineffective responses that would be each of the three options checked that were closest to the negative end of the scale. So as you can see here, some of the responses included 30% of people endorsed that they're picky and on their child's back within the last month. That they raised, 31% indicated that they raised or yelled, raised their voice or yelled. 22% indicated that they got so frustrated or angry with their child that their child could tell that they were upset. 13% indicated that they almost always use bad language. 9% indicated that when things get built up that they do things that they don't mean to. And at the extreme end, we had about 2% indicating that they say mean things or call their child's names when they're angry or upset, or might spank their child. In terms of the marital conflict scale, we can see here that many of the participants indicated that they were angry, or, well, not many, about a third of the participants indicated that they were angry, yelled at, or criticized their spouse about 30% of the time, felt distance or withdrawn from their spouse about 40% of the time, and fewer reported flying off the handle or exploding at their spouse or partner. In terms of how their partner reacted to them, a similar percentage, so about 40% said their spouse was angry with them, 30% indicated that their spouse or partner criticized them, and 30% or 40% indicated that their partner was distant or withdrawn. Oops. Sorry. In terms of mental health findings, about 51% of participants scored within the depressed range when we use the CSD-10 cutoff. And we actually triple checked this number because it was so high, and we were actually concerned that something was wrong with the data collection or that we weren't calculating something properly. But this was an actual number. And when we looked at the actual item responses, what we found was that most of these higher scores were driven by items that were related to coping, sleeping, energy, and effort. So respondents were indicating that they were having a lot of difficulties in these kinds of areas. But if you looked at the more severe items, when people were asked about being tearful or depressed themselves, these weren't endorsed as much. About 12.2% reported severe levels of anxiety, and about 17% reported moderate levels of anxiety. We also asked a question about whether or not there had been any changes in alcohol intake since COVID-19 began. And for about 50% of participants indicated that there had been some change in alcohol intake. And of these, 69% indicated an increase in drinking habits. Finally, we also asked participants that overall, since COVID-19 began, has your children's behavior, mood, or mood changed? And about 50% reported that their child was faring a little or a lot worse. 37% reported that their child was about the same, and 12% indicated that their child or children were a little or a lot better. So in terms of a summary, again, these are very preliminary findings. We've just cleaned the data and looked at it over the last 3 days. But what they are clearly indicating to us is that families are struggling. So we're seeing high rates of reported depression and anxiety by caregivers. They've reported that almost half of their children are faring worse. Those who indicated changes in alcohol consumption have primarily increased their intake, and almost a third of parents indicated that they were engaging in ineffective discipline practices with certain behaviors, and just over 2% engaged in highly concerning practices such as spanking and saying mean things to their child. In about 1/3 of participants, spouses are yelling or angry with one another somewhat to a lot of the time. In terms of methodology, there are limitations to this kind of data collection. With crowdsourcing, it's really a convenient sample. However, we were able to mobilize the survey very quickly and to actually gather data in real time while the COVID-19 lockdown was started. So although there are methodological challenges, there's some advantage to being able to have some information about how families and children are actually doing at this time. So that's the end of this first portion, and I'm going to turn it over to Lil to talk about her study. And just to note, all of these beautiful pictures that are on Lil's slides are taken by Lil herself. So thank you.
Thank you, Andrea. And they are from my neighborhood. These pictures is children who have tried to give encouraging messages to people who have been in lockdown. So Andrea spoke about the parenting survey she led in Ontario. And here I will describe a national representative survey with more than 15,000 respondents, age 16 and older. Data will be collected in all 10 provinces and the 3 territorial capitals. But note that the data will not be representative in the north because the characteristics of those living in the capitals and the rural areas are quite different. So the Public Health Agency of Canada is sponsoring this survey, and the objective is to get timely information about how Canadians are coping during the COVID-19 pandemic. And the survey will be designed and run by Statistics Canada, but the content is developed by the Public Health Agency and Statistics Canada. I guess I should mention that Statistics Canada is our national statistical agency or bureau. An electronic self-administered questionnaire will be used, and those who don't respond will be contacted again by phone to ensure a high response rate. The questionnaire will, of course, be administered in English and French, as Andrea mentioned, because that's the 2 official languages here in Canada, and it's planned to take place in mid-August to mid-September. So similar to Andrea, we have several topics that we try to capture in the study. So we have a general mental health measure where we are trying to more talk about belonging in the society and a little positive start to the survey. We're also capturing topics like anxiety, depression, post-traumatic stress disorder, use of mental health services, and substance abuse. I'm not going to tell you more about the parenting scale, but building on the work Andrea has done in Ontario, we plan to have the overreactivity scale. And we also measured household violence, but I will tell you that in more detail later on. Of course, we are also capturing several demographic variables, as you can see listed on the slide. Last week, during the IPSCAN webinar, Dr. Runyan mentioned the importance of comparative data pre-COVID, so that data that is collected during the COVID period can be compared to a baseline. That is possible for all variables in this survey except the parenting questions in the violence questions. Most of the measures, or all measures, again, except the family violence, have excellent psychometric properties. We choose to partner with Statistics Canada because it has many advantages. They are very experienced in keeping data safe. They are very good at sampling methodology, and they have an excellent reputation that has increased response rates on many surveys. They also have the resources to follow up several times with the selected participants to ensure this high response rate. But of course, Statistics Canada wants to keep this high response rate. They're afraid of upsetting people through asking so-called sensitive questions. And at times this means that questions are changed or that the best questions aren't used. I will explain more about this later on. Andrew also mentioned how many areas the COVID epidemic have touched in people's life. And that also reflects the reality at the Public Health Agency where I work. So when you want topics on a survey, you have to compete with your colleagues, for lack of a better word, because they want to collect information maybe on sleep pattern in children, the time a child spends in front of the screen, if they exercise, and so on, just to mention some few. So now to the violence questions. Statistics Canada recognized early on, already in March, the importance of collecting violence data. So just for you who do not know, in Canada, we have never had any national level data asking either children or parents if children and youth are exposed to abuse. We only have surveys where adults are asked about their experiences. So there was no possibility to have any pre-COVID comparison data. So the first question they asked in this representative survey that went out in March, they asked, how concerned are you about violence in the home? They realized, though, that this question was at times misunderstood because it has a general sense. Some respondent may have answered that they were concerned about the violence, even though it wasn't in their home. So later on, they improved the measure and changed it to violence in your home. Are you concerned about violence in your home? In the survey we are going to do in mid-August, we hope to improve the measures further, where we are actually asking who is targeted. So we are having this first question or the second question, and then we ask, is the violence directed to yourself, another adult in the household, or a child or children? I would have liked, of course, to have data to share with you, but we did not get into the field as quickly as Andrea managed to do. But I thought I could share some of the information we have from other Statistics Canada surveys that have been collected during the COVID crisis. So as I mentioned already in March, Statistics Canada had a national, or not national representative, but a representative sample from the 10 provinces, with this poorly worded question about concerns about violence in the home. And 8% of the respondents had this concern, more women than men. Then after that, they moved the question to crowdsourcing. So they did 2 crowdsourcing surveys in April, one in early April and the second one in late April, with quite big sample sizes. The first one more than 200,000, the second one more than 50,000. And there you can see that 8% the first time, 11% the second time, and again, more women and men were concerned. Of course, these can't be compared, the representative sample and the crowdsourcing. And there was also a slight change, as I said, in wording, but it still provides some indication of the scope of the problem. As you have heard, it is challenging to measure violence during a pandemic due to the sensitivity of the issue, but also for the lack of baseline data. You can shift the slide if you want, Andrea. Different approaches have thus been used, as you have heard, both in Ontario, so in different locales, but also different methods have been used at the national level. And this survey that is going into the field later in the summer, we hope to repeat in the fall as well, because unfortunately, we do not know what will happen when people go back to work. If they have a job to go back to, will there be a second epidemic or a second lockdown? And we hope to release the information from the first survey in the fall. So over to you, Tracy.
Thank you so much, Lil. Okay, so I'm going to be talking about a third survey now, and this is one that we've been doing in Manitoba, and it's called the WellBeing and Experiences Study, and we refer to it as the WE study. So this study, again, it's a different methodology than both what Andrea and Lil had talked about with their work, and this one is a much smaller study compared to the ones that they have been doing in terms of the samples, the respondents, and the method is a little bit different as well. So the objective of the study was, at the very basic level, was just to understand how positive and adverse experiences impact on mental health and substance use and how that might foster resilience in adolescents and young adults. So we asked more specifically about health, well-being, experiences with friends and family at home. We asked about school, we asked about their community, and we were interested in learning about the impact on adverse childhood experiences on mental and physical health outcomes. And we're also interested in learning about what factors might protect people from poor outcomes or what might make people more resilient. So in terms of the methodology, this is a longitudinal survey design, and it also has linkages to administrative data. So at baseline, the first wave of data were collected in 2017 and 18, and they included one parent and an adolescent. So at the time, the adolescents were aged between 14 and 17 years old, and there were 2 interviews that were done. So the parent completed about a 45 to 1 hour interview separately, and the adolescent completed their interview, self-reported interview, for about the same amount of time, so 45 minutes to an hour, also separately. So they did this independently at a research center. Then we were able to also link the survey data to the data that was housed at the Manitoba Centre for Health Policy. So this is data that would include visits to physicians, to the use of hospitalization, use of emergency rooms. It also could link to prescriptions, but also other social service outcomes, and also educational outcomes, justice outcomes. So it's a very large administrative database housed in Manitoba Centre for Health Policy. So we're able to link to those things for both the parent and the adolescent. Then we collected Wave 2 data, which was in 2019 and 20, so we finished that just recently. And that included only adolescents. We didn't actually re-interview the parents, but we asked about the adolescents. And so the adolescents at the time were between the ages of 15 years and 20 years. So the next slide. So again, the main measures that we focused on for Wave 2 were, again, we asked about other indicators of childhood adversity, peer victimization. So we're actually also interested in victimization that occurred with peers and perhaps at schools or online, in addition to family violence. We're very interested in substance use and mental health, peer relationships, family relationships, parenting, coping, well-being, and resilience. So the baseline sample was 1,000. So we had 1,000 pairs. So we had 1,000 parents and 1,000 adolescents. And for the second wave of data, we had 756 adolescents who came back and were able to complete the second wave of data collection. So where this occurred was in Manitoba. It mostly occurred in Winnipeg and Brandon, which are Winnipeg's the capital, and Brandon is another larger city, and also in surrounding rural areas. So we did go out into some rural areas. So importantly, this isn't a representative sample of Manitoba, and we don't even call it a representative sample of Winnipeg. We used random digit dialing for the majority of for a large part of the data collection, but as you can understand, I believe it was something like 30,000 calls had to be made to contact 200 eligible people, because we had to contact the individuals, the families. They had to be interested and continue the conversation, and then many people were interested, but then they had to have a child in the home who was between the ages of 14 and 17. So you can imagine such a narrow age range that even when people were interested in the study, they weren't eligible. So because of that, we extended our sampling to having referrals from other families, or more convenient methods of using social media or advertising in community centers and things such as that. So we did track the data to make sure that we had a really good quality of sample, and we wanted it to be representative based on things like the sex of the adolescent, household income, and neighborhood. So we didn't want just one neighborhood in the area to be collected data on. And we also compared our sample to Statistics Canada data to see how similar our sample was to the population. And we also analyzed differences between the different methods. So did the sample look different if they were part of the random digit dialing group versus the referrals versus the advertisements? And we found actually that there are far more similarities than differences in that group. So we feel like we have a really good community sample, but that's what we call it, is a community sample and not a representative sample. So as I mentioned, it started in 2017 and it's ongoing. So we are planning our third wave of data collection to happen this October. So it will have 3 waves or more of data collection. So wave 3 will be collected in October 2020. So again, we're just going back to the adolescents, and now there'll be adolescents and young adults. So they'll be ages 16 to 21 years old at that time. And we have, for the focus of wave 3, we are going to be adding a COVID-19 module, as well as, and I'll talk a little bit about that, as well as we'll have focuses on mental health, physical health, coping, childhood adversity, family relationships, dating, resilience, and well-being. So now that COVID-19 module that we'll be adding will be planned in October. And so we, in that module, we'll be asking questions about, and so again, we'll be to the young adults and adolescents. We'll be asking about knowledge of COVID-19, behaviors that occurred during the lockdown. So whether or not they did practice physical or social distancing, whether or not they were tested for COVID-19, whether or not they became ill. They'll be talking about emotional support, financial difficulties for themselves or their families, stress, anxiety, depressions, and also questions about thoughts about vaccines if and when one becomes available. So we'll just go to the next slide. So I'm just going to focus a little bit on some of the family violence and adverse childhood experiences, child maltreatment questions that were added. Oh, I think we went the wrong way. Oh no, that's right. Sorry. So yeah, sorry, that was right, Andrea. I'm sorry. Perfect. So if you look at this slide here, you can see that we use the childhood trauma questionnaire. So now I mentioned that in 2017 we asked the parents and the children and the adolescents in 2 separate interviews. So we actually have the sort of a history of adverse childhood experiences for the parent, as well as some questions for the adolescent. So when someone's an adult, you can sort of ask them more things about their childhood history than you can if someone is currently an adolescent. So we do have that, which is kind of neat for this data set, is that we do have the parents' experiences of trauma as well. But we couldn't ask all the same questions when these kids are 14 to 17 years old at baseline. So we asked what we could ask, and so Andrea touched upon that when she did her slides, that we can't always ask some things, and sometimes we sort of need to ask proxies of that. So we did ask a little bit about emotional abuse and emotional neglect. We asked about some of the ACEs, if people are familiar with the ACEs literature. So some of the ACEs, the adverse childhood experiences that weren't the child maltreatment, we were able to ask, but we weren't able to ask about physical abuse and sexual abuse. So our plan is to do that as these individuals become 18 years old. So it will be a retrospective evaluation of these experiences once they become 18 years old, 18 years and older. So in wave 3, if they are 18 years at that time, we'll ask about physical abuse and sexual abuse, physical neglect. But for everyone who's, even those who are younger, we'll also be able to ask about, again, about emotional abuse and emotional neglect. We also have indicators of exposure to intimate partner verbal violence, which are similar to questions that are used in Statistics Canada. We have questions on spanking, which are similar to questions also in Statistics Canada data from the Ontario Child Health Survey from 2014. And we have family relationship variables that also come from the Ontario Child Health Survey from 2014. So questions about expressing feelings, getting along, and being able to confide in each other. So again, we weren't as quick to get this going as Andrea was, and our data collection has occurred in October since 2017. And so we're continuing with that schedule. But what we thought we would be able to do with this is, because we do have previous data, that we'll have data from baseline and wave 2, and then we will be able to add this COVID-19 module. So the idea of this is that if we do have sort of the idea of having ongoing surveys available in a country, and of course this is just a small survey, but if you can imagine if you do have that at a larger level in a country, it's easier to include a COVID-19 module, or whatever the module might be, into something that already exists than it is to sometimes start from scratch when crises happen. So, and then it also allows you to have some of those baseline measures that you might not otherwise have. That's all for my slides.
Okay, thank you so much. Now, Andrea, are you going to take it back now, or did we want to do the poll questions?
We could do the poll questions now. Are you?
Okay, great. So
Yeah.
for the audience, I'm going to be showing, I think, 4 different poll questions. They should appear on your screen, and you have the ability to select an answer. I will let you know that some people have had problems answering due to their internet connection. So if you're not able to select an answer, I apologize for that. So let me start with the first question, and I'll give you just a few seconds to answer and then share the results. Okay, so here's the first one. Are you collecting family violence data to assess the scope of the problem during the COVID-19 pandemic? Presenters, can you see that question on your screen?
Yes, we
Not on
can.
the screen. I can see it in the poll
Okay.
section. Yeah.
Great. So we'll give it just a few seconds here. Okay. Looks like it's slowing down, so I will close that and then share. Okay, can everyone see the results? 27% of respondents answered yes, and 73% answered no. And it looks like about 60% of the audience voted on that one. Okay, so moving on to the next one. Hold on one moment. Sorry, hold on just a second. Okay, sorry about that. Here's the second one. The question is, if you are collecting data, are you collecting data from professionals, families, or children? You can select all that apply. Give it just a few seconds here. Okay, looks like it's slowing down a little there, so let me share that information. So we have 34% professionals, 61% from families, and 34% from children. Okay, great. Sorry, I'm just having a little difficulty going back and forth. Okay, we'll move to the next one. Okay, this question, have you experienced any challenges with this data collection? Okay. And as we can probably guess, 64% say yes, 31% say no. And then I believe we have one more. Okay, the last question. If yes, have your challenges been related to methodology, funding, sensitivity of questions, or other? And you can check all that apply. Okay, and here are the results. 46% for both methodological and funding, sensitivity of questions 61%, and other 37%. Thank you so much, everyone, for answering those questions.
Great.
Okay, and Andrea, let's see, let me close this out. There we go.
Okay, great. Thank you, Heather. And thank you, everyone, for taking the time to respond to our poll. We were really interested in seeing how other attendees and other researchers, whether or not you are actually collecting any data, and if so, have you experienced similar challenges to what we've experienced, and who your primary respondents are. So just to quickly summarize, across all the 3 studies, There were some similarities, but some differences. So in terms of timing, for the Ontario Parent Survey, we managed to launch the study during lockdown, approximately 6 weeks after the initial restrictions were announced. And just as, because it was a 6-week-long survey, just as things were starting to reopen. For Lil's COVID mental health study that's going to be through StatsCan, it's during the easing of restrictions, and another wave of questions will be coming, as she mentioned, at the end of the summer. And Tracy's study, the WellBeing, the WE study, is, in the fall of 2020, so after the first lockdown or perhaps during the second wave. There are differences in terms of the recruitment and design. In terms of, we had a crowdsourcing and cross-sectional survey that was province-wide. Lil's study is national probability sample. And as Tracy mentioned, she has an existing longitudinal community study. Many of our measures did overlap, but as we discussed, and we all highlighted, that there are significant barriers that we had in terms of asking direct questions about family violence, and instead we've had to address it through proxy measures. And then the perspectives of the various respondents were represented differently across all 3 surveys. So there are a number of considerations, advantages, disadvantages, and barriers. Even the poll suggested that, those of us that are launching COVID-19 related surveys, there are barriers to launching the surveys during lockdown. There are funding restrictions in terms of if you don't have existing funding for these kinds of studies, that it's hard to mobilize and get the funding put together in a quick way to be responsive in a timely fashion. As Lil mentioned, in Canada, and this was something that Des Runyon also highlighted in his presentation, that it's important to have baseline measures to compare our COVID-19 surveys to. And as Lil mentioned, we don't have this kind of data in Canada. However, both Tracy and the Ontario Parent Survey did include some measures that have some overlap with, Tracy mentioned the Ontario Child Health Study, which was a province-wide study in Ontario. And because of the overlap of some of those measures, we'll be able to draw some comparisons, at least, or parallels. There's an issue of generalizability, especially for the crowdsourcing surveys. Des Runyon kind of highlighted, both in his presentation and in his response to questions afterwards, some of the concerns by using that type of methodology. However, from our perspective, it was the only way to mobilize a survey in a very kind of quick and timely fashion. And as all 3 of us have talked about, there's really a challenge in terms of asking the hard questions, not only from our institutional ethics boards, but also from some of the survey organizations. So there have been some amazing benefits that really have come out, like to have a silver lining in this cloud. There's a lot in the news in terms of unprecedented collaboration that's happening around the pandemic between governments, academics, philanthropists, and industry. And this isn't only true for the medical biological field, but I think for our field as well. From our perspective, there's been an unprecedented sharing of information and ideas. We really have to applaud ISPCAN for mobilizing so quickly to get these series of webinars out there, and really to such a large audience, and for doing such a fantastic job in doing so, and to the Journal of Child Abuse and Neglect for already putting out calls for COVID-specific special issues. And finally, I also wanted to note, Jamie Lockman had given a webinar actually a few weeks ago on the initiative across many organizations led by the Parenting for Lifelong Health group, and their impressive ability to put together these COVID-19 parenting tip sheets that are available in so many different languages and available for free and worldwide to really be helping parents and caregivers during this unprecedented time. So some of our lessons learned, there is definitely a need to invest in ongoing baseline data collection on family violence. We don't have it here in Canada, and so there's no baseline to compare it to. Moving forward, it will be critical to gather information on proxy informants, collecting information from domestic violence shelters, professional societies like medical associations, police data, and administrative data. Finally, it's impossible to have a discussion in this kind of format, but we really wanted to put out some questions in terms of future considerations. So how can we capitalize on the current momentum? Because there is a real appetite for actually collecting data, even if it's not specifically on family violence, to be asking the proxy questions about how families and children are doing. So how can we leverage the current situation to move the field forward? And how do we learn from this experience to better prepare ourselves for the next crisis or situation? Because it may actually happen again, not just the second wave, but another pandemic. So I'm just going to leave this slide up with our contact information, and we would really love it if people wanted to email us about your own research and studies that you may be conducting, or if you have any questions at all, please reach out to us. So thank you again for your time.
Wonderful, Andrea. Thank you so much. And thank you to all of the presenters today for sharing all of this great information. We do have some questions from the audience that I'd like to ask. Oops, we're getting a little bit of background noise. Okay. So first, several people are asking whether copies of the surveys that you've used or the results that you've had are publicly available. Maybe if you could each address that real quick.
Sure, I can go first. It's Andrea. So for the Ontario Parent Survey, we have not posted our questions yet, but I'm happy to share them with anybody who contacts me directly. As I mentioned, we literally just finished these preliminary analyses, and there's much more to be done because there's a lot more data that was in the questionnaires, but we will be posting information on our Offered Center website at McMaster University as we get high-level summaries prepared and infographics prepared.
Okay, great.
And from the study I talked about, the three were provided results. You can find those results on Statistics Canada's website. However, it's not totally easy to maneuver. So if you write to me, I will send the exact web links. We, of course, have no data yet, so it is not available, but will be this fall. We have done analysis plans and so on, so we think we will get out the information quite timely once we have the data, although it always takes some time to wait the data to be representative for the population.
And for my study, we don't have the questionnaires online, but I have shared with people who are doing related work. And we recently have had our first two publications with the data, one in child abuse and neglect, and the other one in BMJ Pediatrics, and so that they kind of give an overview of our initial findings with regards to adverse childhood experiences and substance use.
Okay, great. Thank you. So I'll start off. We have some specific questions for Andrea's the work that she talked about, and then we'll continue with some more general questions after that. So Andrea, we've had some questions about the interviewing process. Attendees would like to know how the participants were interviewed, if it was an online survey or an emailed survey. I guess that might be the same thing. I guess how it was distributed. And then also a question about how you ensured that parents who may not want to be included are represented. For example, thinking about marginalized groups, for example, poor families and minorities.
Yeah, thanks for that question. So this was a crowdsourcing approach that we took. So it was online. We registered a website, ontarioparentsurvey.ca. That's the English one. I cannot remember or probably pronounce the French version. And so parents were sent the link to the survey via the different methods that I mentioned previously. So we had sent out social media ads and different kinds of ads through all sorts of partner organizations, so the school boards, through the Ontario Municipality Association, through the Ontario Nurses Association, through public health units across the province, and our partner mental health organizations. So we did not, it wasn't any kind of random digit dialing or email. It wasn't sent to parents' emails directly unless it was through the school boards. So they were just provided the link, and then they could go to the website, click on the link to read about the study, and then would have to provide informed consent through a drop-down box. And then after they provided consent, then it would take them to the survey, and they answered all of the questions online. In terms of, sorry, the second question about representative of minorities, again, this was a convenience sample, so we sent the link out as far and wide as we possibly could. We cast the net as wide as we possibly could. And we didn't, based on some of the demographics, we certainly captured some of the more vulnerable groups in terms of sociodemographics and different ethnicities, but most of our sample would have been more highly educated, and we didn't ask questions about income, so we didn't have anything about that.
Okay, so. Thank you. Great, so we have another question here asking about, Andrea, with your study, to what extent does the data line up with existing prevalence data? For example, you said less than 3% reported spanking, and this person is asking, do you think this is an underreport or an actual representation?
So that's an excellent question, and the answer is, to be truthful, I don't know yet, because like I said, we just put the results out there for today's webinar, and I haven't had a chance to look at the comparison data. We did have spanking questions in the Ontario Child Health Study, like Tracy mentioned, so we will be able to pull some of that data and compare it, as well as data related to family functioning and caregiver mental health. But Tracy's probably better positioned to answer the question about whether or not 2% is an under or over report. Tracy, do you have any thoughts about that?
Yeah, I mean, we don't have very good data on that, so I can't say, I can't reference any specific data, from Ontario or at the national level in Canada, and that's a definite limitation. But I, would guess that is definitely an underrepresentation.
Okay, thank you so much. The rest of the questions are more general, so whoever feels they would like to answer, just jump in. We had a question just about what measures have been taken by social service programs to provide support and protection for children during this time.
So the governments.
Go ahead, Lil, sorry.
Yeah, so the governments in Canada, first of all, have come together to respond and provide some income assistance, provide support to helpline and other various programs to help children. And then there are several programs at the provincial territorial levels. And Andrea, you're probably better to speak about that.
Yeah, I was going to mention a couple things. One is that what Lil had mentioned about the financial and income support, and we had actually asked questions on the Ontario Parent Survey whether or not people knew about the various financial opportunities that were being offered by both the federal and the provincial government, and what percent of people had actually applied for it. And I was quite surprised to see about 46% of our sample had applied for some sort of financial support. At the community level, because we are involved in various parenting interventions, we have been in touch with child welfare agencies, as well as some of the child mental health organizations that offer parenting programs. And I mean, like everybody, when lockdown kind of occurred, they had to pivot very quickly to different kinds of models of providing parental support. So if they were already in touch with families and families were already part of the system, then they would triage some of the families and continue to provide the parenting interventions or programs. A lot of organizations, I would say really rather quickly, within the first month or month and a half, went to various online platforms to provide their various interventions and programs. So they're using things like Zoom Health or even WhatsApp or telephone calls or Microsoft Team meetings to be helping families. So there is support out there for parents. I don't know how many parents are accessing it. Again, I didn't talk about it during the presentation, but we asked a question about whether or not parents felt that they would need help with different things. And about 60% of respondents indicated that they could benefit from help with respect to their child's mood or behavior, and with respect to their own mood and behavior. And about the same amount, so about 60%, said that they would be interested in receiving tips and information about how to cope with various parenting challenges as well.
Okay, thank you. There's a question here about kind of related to what you were saying in terms of collecting information and getting information out. Do any of you have experience collecting data in areas that lack internet access? And how do you manage this limitation?
Yes, from Statistics Canada, they have, as I said in my part of the presentation, they are doing follow-up via telephone.
Okay, Lil, are you still there?
Yes.
Okay,
So,
sorry, I couldn't.
Yeah, so they're following up via telephone for people who do not have, they have a sampling frame and they use internet where possible to the randomly selected participants, but they also follow up since not everyone have access to computers. They follow up with phone calls.
Okay. Tracy or Andrea, do you have anything to say about internet and restrictions around that?
No, I mean, from our perspective, because it was a web-based survey, it certainly was a concern that we wouldn't be reaching people who did not have, obviously, internet access or were in more rural areas. Our provincial government in Ontario, all of the school boards mobilized very quickly to be helping families that didn't have either computers or iPads or laptops, and actually provided families with these. So we know that at least families were provided with the technology. And then also we're trying to help families through hotspotting in order to get internet access, but because of distance learning kinds of purposes, but that's slightly different. But we had no other kind of route in terms of asking these questions. So.
Okay, thank you. There's a question about whether family violence or how family violence is criminalized in Canada, and if there is a reporting obligation for third parties to report family violence against children and adults.
Yes, there is, for child maltreatment, there is reporting obligations for third parties to the child protection agencies or to police.
Okay, does that apply to schools as well?
Yes, that would be several, that could be service providers, schools, etc. And that's why we thought that it was good to go to the general population or community-based surveys, because we expect that reporting would be down during this period, because teachers and other healthcare professionals and social service workers would not see their children during this time the same way as they did before the pandemic started.
Okay, thank you. And I think we have time for maybe one more. This one is just kind of a general question. What steps can researchers take for national child maltreatment data to be collected during these times, especially thinking about developing countries and under-resourced countries, and how to make this a priority?
That is a very, very good question. And I wish I had the answer to it, because we have the problem already. And among the questions Andrea put, as we of course can't discuss in this forum, it is a challenge. We have tried to use, and I think this is almost a nice segue to John, who I know will give some closing remarks. Things like the child maltreatment data collection working group that is run out of ISPCAN try to strategize how to collect these kinds of data in various countries.
Okay, great. Thank you for that. And yes, so I want to thank the audience, everyone, for sending in your great questions. And as the presenters said, please feel free to contact them directly if you have a specific question that we couldn't answer today. Thank you, Lil and Andrea and Tracy, for being with us and sharing this information. And now I would like to introduce John Fluke, who is an ISPCAN counselor and associate director at the Kemp Center, and also our convener for our working group on data collection, who's going to speak a little bit about the group. John?
Thanks, Heather, and thanks also for all your work at moderating this session and the others that we've had. Also want to, send my thanks to Andrea, Tracy, and Lil for a really engaging and interesting presentation today. As Lil mentioned and Heather mentioned, I represent the ISPCAN working group on child maltreatment data collection. And Wanted to just let people know that we're continuing our efforts to try to bring this topic to the fore. The working group is charged with trying to improve the global capacity to access high quality data on child maltreatment. And we provide a forum for researchers and policymakers regarding data in order to try to work through, as Lil was pointing out, strategies to improve the data and its the capacity of countries to collect it. We also conduct collaborative processes, including developing resources, joint publications, and other projects to try to promote that particular mission. Just want to close by saying that in this time, it's important to stay connected and to learn as much as we can about child maltreatment in the time of coronavirus. So we're continuing to do that as a working group, and we would hope that many of you on this call would also join us in that. First step would be, if you haven't become already, is to be a member of ISPCAN, as that provides a conduit for information and ideas, and also as a direct way to get involved in the working group. So thank you for that. And again, thanks to our presenters for a very informative presentation today.
Thank you, John. Thank you, John. And he took the words out of my mouth. We would like to invite everyone to consider joining ISPCAN as a member if you're not already, so that we can continue having webinars like these. Our member benefits include discounts to our congresses, which are resuming in 2021 in Italy and Australia. We offer several membership levels, including a new associate membership, which is $35 a year. And we would also like to invite you to visit our COVID-19 resources page for a variety of resources for professionals, parents, and children, and to learn more about our upcoming webinars, including our next one on June 24th, presented by Together for Girls and the CDC on the Violence Against Children and Youth surveys. In conclusion, to learn more about ISPCAN, please visit us at ispcan.org. A recording and the slides from today's webinar will be posted on our website shortly. If you have any questions or comments, please contact us at resources@ispcan.org. Thank you all again for joining us today. We hope you stay safe and healthy and have a great day or night, depending on where you are. Thank you to all our presenters. All right, bye-bye, everyone.